Though you can't stop the aging process, you could certainly put the brakes on it, and our next guest helps people understand all the options available. Dr. Robert Langdon is the medical director at the Langdon Center for Laser and Cosmetic Surgery. He's back with us today. Welcome to the show. So we're going to be talking a little bit about facelifts today and the 6 most important questions that you should ask. So I guess we should get right to it with these questions.
Yes, I want to say facelifting is a kind of complicated. There's so many different ways to do it, and it really helps the patient to know in advance to educate themselves about the options.
Okay, and the first question here on our list, we're talking about the incision.
Yeah, the incision in the skin is what you see on the surface. And the advantage of a minimal incision, it's much shorter than the traditional facelift, and it heals in a very natural way. It should be, pretty much undetectable to the casual observer.
I believe we have the picture right up on our screen, and
yeah,
you can point out the incision for us.
That blue line that is primarily in front of the ear, it just goes slightly behind the earlobe. It does not go behind the ear a lot the way a traditional facelift incision would. And therefore, it is much more easily obscured and really should not be detectable.
Okay, and moving on to our next question, the discussion of anesthesia would probably come up.
Anesthesia is very important, especially when it, because it helps with the recovery. Recovery is much quicker if local anesthesia is used. It minimizes bruising and swelling, and most people should look pretty good within a week.
Okay, and then the third question, we're talking about liposuction involved in this facelift.
One thing to always consider is the neck, and majority of people have excess fat beneath the chin, and it's very important to remove that fat to improve the contour of the neck. The jowl is also a fat pad in the lower cheek, and it helps to reduce that one as well. So great majority of facelifts look a lot better if liposuction is also done. Okay,
and then the next question is the loosened skin. We're talking about the fascia and how that has to be mobilized.
Yeah, there are different layers. You have the skin on top, and then usually there's a little bit of fat right below the skin. And the important thing with a facelift is a layer called the fascia, which is a connective tissue layer that is very, very tough. And when we pull the fascia, what we're doing is lifting, reversing the sagging that gravity has caused. And this diagram here, this is from a book chapter that I wrote for a surgical textbook. And it's showing those little gray areas. That's actually where the fascia is attached to the underlying structure. So it's important to loosen that so the fascia is able to move more. So that's the key to a long-lasting result in a facelift.
Okay, as we move along to the 5th question, we should probably ask, how long are you going to be out of commission? How long does this procedure take?
Well, with the minimal incision technique done under local anesthesia, recovery is very fast. Most people would look quite good within a week. They do have to have stitches on the surface, and those are removed usually 7 days afterwards. Okay,
and then that covered our recovery period also. So that probably people should come in with a list, maybe just so they're prepared, know what to talk about with their doctor.
Ideally, yeah. The recovery period is really determined by the anesthesia more than anything else.
Okay.
So the local anesthesia, not only is it safer, but it allows us to use a lot less sedative, and compared to general anesthesia, it's much safer.
Okay, and let's take a look at some of the before and after pictures that you brought for us. We're looking at, this is definitely a before picture.
Right.
And then if we move right along to the after, oh, you could definitely see that everything is kind of lifted and tightened.
This after photo is 7 days later, and if you look closely, there are still some stitches in the area in front of the ear. And there's a little bit of swelling, but very little bruising, and this is what we like to see as far as a quick recovery.
Okay, very good. And you could definitely see the difference before and after. And this is a second patient here, before.
Yeah, this is a patient who had both a facelift and a brow lift, and she shows also the improvement in the sagging, the lower part of the cheek and the neck would be improved from the facelift. And the area around the brow would be from the brow lift.
Okay. Doctor, let's talk about an upcoming seminar where people can get some more information.
We have a seminar next week, and we talk largely about the aging of the face, exactly what goes on with the facial aging. A big part of that is the effect of gravity, which causes sagging, and lifting, especially a facelift, helps the face and the neck.
You can't avoid that gravity. That's going to hit you.
Right.
Unless
Unless you're an astronaut, you will be subjected to gravity pretty much all the time.
All right. Well, Doctor, we're out of time. Thank you so much for the information. All the information about the Langdon Center is there on your screen there. And that's also the seminar on May 19th, 7 p.m. Again, thank you for being here. And coming up next on Connecticut Style, the elegant occasion shows us how to entertain with ease. Don't go anywhere.